Hello students, today we concentrate on the popliteal fossa. I'm Dr. Gaurav Agnihotri. So the popliteal fossa, what it is, it's a diamond-shaped depression. So diamond-shaped depression situated at the, so this is the diamond shape, and the diamond-shaped depression situated at the back of knee joint. So lower part of femur, upper part of tibia and back of knee joint, there we have this diamond-shaped depression. So you can make out the shape. It's like a rhombus, like a diamond. Okay. So this diamond-shaped depression has got on the superolateral aspect biceps femoris, superomedially semimembranosus, this flattened muscle, and semitendinosus, this tendon of semitendinosus is seen superomedially. So superolaterally biceps femoris, superomedially semimembranosus and semitendinosus, infерomedially medial head of gastrocnemius, inferolaterally lateral head of gastrocnemius supplemented by the plantaris muscle. And be careful regarding the spellings of gastrocnemius. Gastro, C-N-E-M-I-U-S. Students mostly write them wrong in the examinations. So these are the boundaries of the popliteal fossa. The roof is formed by the D fascia, while the floor, it is formed by the popliteal surface of femur, capsule of knee joint, and the fascia covering the popliteus muscle. So one can appreciate the diamond-shaped shape here, drawn in red. So diamond-shaped popliteal fossa and its location in relation to the lower end of femur, upper end of tibia, and the knee joint. And the floor is formed by, from above downwards, popliteal surface of femur, capsule of knee joint, and fascia covering the popliteus muscle. So in the examinations, invariably a question comes, write a short note on popliteal fossa. Then you have to describe the boundaries of popliteal fossa and the contents of popliteal fossa. So there are 8 contents of popliteal fossa. So along with the lymph nodes and the fat, what are the other 6 contents? 4 are the nerves. So what are the nerves? Tibial nerve, common peroneal nerve, genicular branch of obturator nerve, and the posterior cutaneous nerve of thigh. So we can appreciate the tibial nerve and the common peroneal nerve here in the diagram showing the main structures of the popliteal fossa. So this tibial nerve and common peroneal nerve, they are superficial structures and they lie in the same plane. Tibial nerve crosses the popliteal fossa vertically, while common peroneal nerve passes from superior angle to lateral angle along the medial border of biceps femoris. So deeper to the tibial nerve is the popliteal vein, which crosses the fossa vertically. So still deeper is the popliteal artery. So the deepest structure is the popliteal artery because the nerves, they lie in the same superficial plane. So you've got tibial nerve and its branches lying superficially. Deeper to that, you've got the popliteal vein and its tributaries, and still deeper, the popliteal artery and its branches. So when we describe these structures, the 3 main structures, tibial nerve, popliteal vein, and popliteal artery, their relative position in upper, middle, and lower part of the fossa also needs to be described. So there we have to remember the word AVN, NVA, NVA. So A stands for artery, V stands for vein, N stands for nerve. So AVN is from medial to lateral side. In the upper part of fossa, we have got AVN. So popliteal artery, popliteal vein, tibial nerve. In the middle part of fossa, from behind forwards, we have got the tibial nerve, the popliteal vein, and the popliteal artery. So AVN, AVN. So in the middle part, we have got NVA, from behind forwards, tibial nerve, popliteal vein, popliteal artery. And in the lower part of the fossa, again from medial to lateral side, we have got NVA, nerve, vein, and artery. So AVN, NVA, and in the lower part again, we have got NVA. So in the lower part again, we have got NVA. So remember this thing, that you have to describe the structures in the upper part of the fossa, arrangement of structures relative to each other in the upper part of fossa, middle part of fossa, and lower part of fossa. So we have got AVN from medial to lateral side in the upper part of fossa, NVA behind forwards in the middle part of fossa, and AVN from medial to lateral side in the lower part of fossa. So these are the main structures in the popliteal fossa. So this popliteal artery, from where does it begin? This popliteal artery begins at the junction of middle and lower 1/3 of the thigh. So it begins from adductor hiatus, that is the opening in the adductor magnus. And this popliteal artery at the lower border of popliteus divides into anterior and posterior tibial arteries. And this popliteal artery is utilized for determining the blood pressure of the lower limb, blood pressure from the lower limb. Now, this is the schematic representation of anastomosis around the knee joint. So the first question asked from this region is, describe the popliteal fossa with its contents. The second question is, describe the anastomosis around the knee joint. So whenever you have to describe the anastomosis around the knee joint, this schematic diagram is useful. Anastomosis around the knee joint ensures blood supply to the back of knee joint, lower part of femur and upper part of tibia. So it ensures the adequate blood supply to the bones forming the knee joint, the synovial membrane of the knee joint. So this anastomosis around the knee joint in the popliteal fossa, how it is formed and how it is to be described. So in this schematic diagram, you can make out the branches of the popliteal artery are shown in red: superior lateral genicular, inferior lateral genicular, superior medial genicular, inferior medial genicular. Okay, so we described this anastomosis, that this anastomosis is formed above the lateral condyle by a union between superior lateral genicular branch of popliteal artery and descending genicular branch of lateral circumflex femoral artery. Below the lateral condyle, this anastomosis is there between inferior lateral genicular branch of popliteal artery and anterior posterior tibial recurrent branch of anterior tibial artery and circumflex fibular branch of posterior tibial artery. So the branches of anterior and posterior tibial arteries are shown in blue here. So above the medial condyle, the anastomosis is formed by descending genicular branch of femoral artery, anastomosing with the superior medial genicular branch of popliteal artery, while below the medial condyle, the inferior medial genicular branch of popliteal artery anastomosis with the saphenous branch of the same descending genicular branch. It gives off a saphenous branch, and this saphenous branch anastomosis with the inferior medial genicular branch of popliteal artery. So this was about the anastomosis around the knee joint. You should have an idea which vessels are forming the anastomosis around the knee joint, and describe the anastomosis around the knee joint like this: above the lateral condyle, below the lateral condyle, above the medial condyle, below the medial condyle, how it is formed by union of different arteries. Practice this flow chart, draw it in the examinations, it will be useful. Now, third question which comes from this portion is, first was popliteal fossa and its contents. Second was anastomosis around the knee joint. Third question which comes is, write a short note on popliteus. So popliteus muscle, its origin has to be described. Its origin is tendinous and intracapsular. So this muscle arises from lateral condyle of femur, lateral surface of lateral condyle of femur. Remember this, lateral surface of lateral condyle of femur, there is a popliteal groove there. From its anterior part of the groove, popliteal groove, the tendon of popliteus arises from the lateral surface of lateral condyle of femur. This tendon is intracapsular. Yes, and origin is of the muscle is tendinous, and this muscle then it goes down and gets inserted onto the posterior surface of the tibia above the soleal line. The insertion is fleshy. Origin is tendinous, insertion is fleshy. Also, this muscle is arising from the popliteal groove on the lateral surface of lateral condyle of femur, the anterior part of the groove. It also arises from the outer border of lateral meniscus muscle. So the significance of this is that it protects the lateral meniscus muscle. Whenever the flexion is taking place, popliteus muscle, flexion of knee joint is taking place, popliteus muscle, due to its attachment to lateral meniscus, retracts the lateral meniscus and prevents it from being crushed between the condyles of femur and tibia. So it protects, even God is partial, I describe it like this, that lateral meniscus injuries, they are less compared to medial meniscus injuries, because God has protected the lateral meniscus, because the lateral meniscus outer margin is giving origin to popliteus muscle, and popliteus muscle, when it contracts, it retracts the lateral meniscus and prevents it from being crushed between the condyles of femur and tibia. Medial meniscus, due to its fixity to the tibial collateral ligament and its greater excursion during rotational movements, is more liable to injury compared to the lateral meniscus. So this muscle, its origin and insertion. When you have described, mention its actions. Since it is lying at the back of knee joint, so when it will contract, it will cause flexion of knee joint. Then second action is, I told you, it protects the lateral meniscus. Third action is that it is the unlocking muscle of knee joint. So how does it unlock? It causes the lateral rotation of femur on the tibia during the initial stages of flexion. So it is an unlocking muscle of knee joint. So mention all the three actions of popliteus muscle, and then along with it, you have to describe the nerve supply, that the nerve to popliteus supplies the popliteus muscle. It is arising from tibial nerve. It passes in relation to the lower border of popliteus muscle, and it supplies it from its deep surface. So popliteus muscle is supplied by nerve to popliteus from its deep surface. And this nerve to popliteus also supplies the tibia, the deepest muscle of the leg, the tibialis posterior, and along with it, the superior, middle, and inferior tibiofibular joints. The middle tibiofibular joint is the interosseous membrane. You can also mention here when you write the answer that to this question about popliteus, that at the lower border of popliteus, the popliteal artery is dividing into anterior and posterior tibial arteries. So do mention all the facts in a proper manner, and attempt the question on popliteus muscle carefully and in detail. So you have to mention the origin, insertion, you have to mention the actions, you have to mention the nerve supply. Okay, and when you mention the nerve supply, nerve to popliteus also supplies. So you have to mention all these things. And mainly this question is asked because popliteus is the unlocking muscle of the knee joint, and it protects the lateral meniscus from injury. So with that, I complete my class today on popliteal fossa. 3 important questions. Contents of popliteal fossa, remember the 8 contents. Then anastomosis around the knee joint, and a short note on the popliteus muscle. So till the next time we meet, it's bye from my side.